and we have reached quite a significant number of people via the Zoom online platform. Today's topic is COVID-19 risk assessment training. It is effectively an update and a repeat of the topic, which is very important to repeat and remind us of the importance of why risk assessment is an ongoing, continuous process and continuously needs to be updated for the purposes of hazards like COVID-19, a biological hazard, as this particular workplace hazard is shifting all the time as new science and new information becomes available. So again, welcome to this particular session on behalf of the NIH. We have quite a number of good presenters that is going to deal with certain topics, and I'll speak to that in a moment. Risk assessment is critical for all workplaces and for all health and safety functionaries, from the most senior person representing the company in management, CEO, directors, and so on, to those who have been mandated certain responsibilities in terms of health and safety, including the health and safety officers, the occupational medical practitioners, the occupational health nursing practitioners, the health and safety representatives, and all management and supervision, including those who represent the worker interests in terms of the trade union representatives, etc. And you also have the roles of the occupational hygienist with regard to this critical aspect of risk assessment. So we are pleased to bring again a very critical topic as part of the 2021 series of COVID-19 webinars, and to ensure that you have your most up-to-date risk assessment in place formally within your workplace, to ensure that our COVID-19 workplace preparedness and prevention processes and programs and steps are in place to ensure maximum COVID-19 containment and prevention within our workplaces. And in that, as part of the larger approach within our country, within our nation, to ensure that COVID-19 is in fact dealt with in all spheres, as well as the public and community and our family homes. So a few virtual housekeeping rules quickly. Firstly, because we are potentially going to be oversubscribed over our 100,000 logins that we are permitted in terms of our Zoom license, this webinar is going to be live streamed as well on the YouTube channel. So I will paste the YouTube channel link in the chat box so you can share it with colleagues who will let you know that they might not have been able to get in. We have been over subscribed in terms of those who have registered prior to logging, to over almost 2,200 people that have registered for this particular webinar. So we therefore do not have your microphones activated as attendees, and nor do we have your video functions activated as attendees. Please use the question and answer box to type your questions for the presenters. Please use the chat box for any other general admin comments you may want to make. And we do not, unfortunately, respond to the hand-raising function because it's not possible with such a large number of attendees to do that. So over to the program and its content. We have the introduction on COVID-19 preparedness and prevention in the workplace by Dr. Graham Chin, who is a leading member occupational medicine practitioner in our SHE department, the Safety, Health and Environment National Department in the National Health Laboratory Services, based within the National Institute for Occupational Health, the NIH. And I will be introducing him in a moment. Our second presenter on the principles of health risk assessment is Gabriel Mizan, and affectionately known as Gabby, who's from our immunology and microbiology section of the NIH. And then our third presenter is Dikiledi Matuka, who is a leading member of our immunology and microbiology section here at the NIH, and she will be dealing with the risk assessment too. That will be followed by our Q&A session. So I'm going to now immediately ask Graham just to check if his microphone is working and if he could share his slides. And in the meantime, by way of introduction, I would like to just briefly introduce Graham. Dr. Graham Chin is an occupational medicine practitioner currently working for the National Institute for Occupational Health as a part of the National Health and Body Services. And he is a part of the Safety, Health and Environment Department tasked to service the National Health and Body Services. I think over 7,000 employees throughout the country in hundreds of health facilities and laboratories. Dr. Chin has been working full-time as an occupational medicine practitioner since 2010 in both private and public sector across various industries, and that includes mining, construction, waterworks, automobile, manufacturing, machinery, food and catering, and the corporate sector. Over the last few years, he has dedicated himself to the public sector, trying to improve laboratory-related occupational health and safety. And with that very, very brief introduction, because I'm sure there's much more I can say about Dr. Chin's contribution to the overall COVID-19 cohort, that is the Occupational Health Outbreak Response Team here at the NIH, and activities broadly within the NHRS and beyond our organization. I immediately hand over to you, Graham. If you could I see that you are in a mode where I can see your presenter slides as well. So I'm not sure if you should perhaps restart that, unless it's okay for you to share your presenter slides live on Zoom. Just as a reminder, while we are sorting out the presentation slides there, please type your questions in the Q&A box and your general comments in the chat box. Graham, I can still see the slides. I think there's a setting in the PowerPoint which deactivates, and maybe Tabani from our IT section can quickly just guide you. And so for our attendees, we are having this particular webinar CPD accredited by those professional bodies that have provided such accreditation. And we will also be offering you the general certificate of attendance to all of those who attend. For the CPD points, a link will be circulated after the webinar with a password for you to complete the CPD online test in order for you to secure the CPD certificate. And as a reminder, yes, there will be a general certificate of attendance. Post the webinar, we will be posting all the links for the presentations and the video recording, etc., on our online website and YouTube channel. Please visit the website and YouTube channel. At this point, I'm going to hand over to Graham. Graham, thank you for joining us today and taking the time out of, I know, your very busy schedule in order to share this particular presentation with our attendees. Much appreciated. Please proceed.
Thanks, Ashraf. Good morning, everybody. I hope the slide is projecting properly. So we're going to look at COVID-19 preparedness and prevention in the workplace. I think that it's hard to believe that we're almost 1 year into COVID-19 and so much has happened and so much has stayed the same, etc. But I think that for many organizations, especially probably the larger groups and industries that are well established, hopefully by now most COVID preparedness has already been somewhat put in place and prevention measures already in action. So, you know, what I'm going to present is really a high-level overview. It might be a bit basic, but it might serve as a good reminder and a checklist in an ever-changing environment we're going through. It also, I think, presents an opportunity maybe as the economy has opened up with more smaller business and maybe medium enterprises coming back into play, to have a look at occupational health and safety in their settings, because I think that with lockdowns that have occurred, etc., perhaps many businesses have not fully opened completely. So, you know, hopefully this can provide just maybe either a checklist, or for those people that are starting out, maybe bring some awareness to what needs to be considered. And I think, you know, COVID-19 is not going to go away immediately. So I think some of these preventative measures and OHS principles will carry through even beyond COVID. As we have seen, there are so many new evolving biohazards and just generally even hazards in the workplace that need to be attended to. So, you know, once again, we've moved on a year. There's a lot of new information. I think the hype that's going on at the moment is sort of the COVID-19 vaccine and what's happening on that. And just as recent as December, when all of us, or those of us who might have had the opportunity to get some sort of rest amidst all the lockdown, etc., there was even a new variant that arrived, a 501Y. V2. So there's been a lot of movement from a year ago. But having said that as well, there's been a lot of things that have stayed the same. I think precaution-wise, in terms of transmission and how COVID-19 is transmitted, much has also somewhat stayed the same. We're still looking at masking, we're still looking at social distancing, and those are the sort of principles we might just want to relook at and cover. So this is just a slide taken from the NICD, the National Institute for Communicable Diseases, demonstrating over the last year what has happened with COVID and the number of cases over time. And really just what I wanted to show you is typically what people were speaking about the waves. The first wave, which occurred last year, and you can see there quite a nice graph. It actually does show the wave occurring possibly around between May and somewhat tapering down at around August the 30th. And then we did enter the second wave, which sort of came towards November and then sort of spiked there into the late December, early January, and sort of we slowly seeing tapering of cases. So, you know, we've had these two waves that everybody spoke about, and you know, that just demonstrates how COVID has really affected our country. I think the important message to get across is that, you know, as information changes, and I think it's demonstrated by so many people on this platform, is that you got to try and find the most accurate documents. Once again, I think these are very credible sites and where information is readily available. Look at the NIOH website, look at NICD, and of course, look at our Department of Employment and Labour, which shows the employment directions on what workplaces do really need to consider. Look at National Department of Health. I think they're driving a lot of information, especially with vaccines, etc. So it's critical that everybody does reach the right websites. We also have international and global websites that you can get information from, the WHO, CDC, but I think it's nice to type down to sort of local relevance. Okay, so into the talk. Like I say, I've got some very good colleagues that are going to come after me, and they're really going to give you a rundown of risk assessment. And that's why I say I think it's going to serve a lot as a reminder for those people that have established occupational health systems, but definitely for those people who are new at the game and maybe opening up new businesses, I think it's important that you have a look at some of these principles. I can't cover all industries. We've got people from the health sector. We've probably got people from construction, retail, mining, food and beverage. So we've got a range of people, and it's very difficult to obviously target sometimes what might be relevant specific to your industry. But I think have a look at maybe the highline principle of how we apply occupational health. So it's a bit strange. I think our topics have been slightly reversed because I'm actually going to speak a little bit more about the control measures and just maybe provide some context of COVID-19 control measures. But like I say, the colleagues that are going to speak after me are going to look more specifically at the first step, which is really always the risk assessment, because the risk assessment informs the actual control measures. But if we look at just generally, how do we control COVID-19 and how do we prepare our workplace for COVID-19 and what are we going to do? I think there's a very strong principle that always is applied in occupational health, and that's the hierarchy of controls. It's a very, very popular method to apply. It's easy, and I think it breaks it down quite nice and gives a good approach. You can see it is a pyramid, kind of turned upside down. But really what I wanted to focus in my specific talk, and for people that are new to this, is really around the engineering, administrative, and the personal protective equipment controls. Because I think in the context of COVID-19, elimination can be a little bit tricky if you're a one business person on your own, perhaps you can eliminate COVID-19 completely from your workplace, because you won't have people coming in potentially that are infected. You're kind of working by yourself, and you might be able to work remotely and run your business like that. But let's face it, most industries have clients, most industries have workers. So the potential to be exposed to COVID-19 kind of makes it very difficult to apply elimination and substitution principles. So you have to look a little bit more broadly at maybe engineering controls, administrative controls, and personal protective equipment for your workers. Now, the hierarchy of controls, as many of you will know who've been in the game, is that the most effective ones are obviously towards elimination, substitution, and engineering. The unfortunate side to it is that it's often very expensive, it's difficult to implement, and it has its impact on business in its own right. Going down the pyramid, and probably one of the more, if I can loosely say it at this stage, easier methods to apply is PPE. But the biggest downfall, and many people will know, is that it's not often easy for a worker to wear PPE for long periods of time. And sometimes PPE can be viewed as a very cheap option, depending on the range and the quality of the products that you're buying. But I think the message that needs to be taken home with the hierarchy of controls is that the best approach to control COVID-19 in the workplace is to have a combination of all of these factors, taking from each area, from each group, and applying it appropriately. So I'm going to try and go through a few of examples of what COVID-19 controls would look like in some of each of these categories. And once again, I'm going to focus primarily on the administration controls. But I just wanted to show you, just as a broad idea, engineering controls are something where you might modify or equipment that's existent in a workplace, or install new equipment to try and reduce that exposure. So the common thing, and it's quite interesting if you go to many, for example, if you take the retail sector, for instance, people have put up physical barriers. So the picture on the left in an office shows physical barriers to try and prevent people from spitting and splattering and splashing each other. And it is an effective barrier method to potentially stop transmission, provided you also apply some administration control measures to it. Other simple methods of engineering controls could include, for example, ventilation is a good common one, and you can get sort of from basic ventilation is obviously putting in windows, opening, getting natural air into the room and diluting the exposure, if you want to think of it that way. And it can range up going right all the way to very expensive engineering ventilation control measures, where you're putting in some very sophisticated artificial and mechanical ventilation. For example, in my setting, in the laboratory setting, where my workers work a lot with specimens testing for COVID-19 in a laboratory, we, for example, use an engineering control measure called a biosafety cabinet. And these are often class 2, or even in more sophisticated laboratories, you can get class 3 biosafety cabinets. But what it really does is it separates the worker using a barrier as well as airflow to try and prevent exposure. So these are just a few very simple examples of engineering controls. Okay, if we move on to administrative controls, because I think in general business and in most industries, this would be very much applicable. And really where administrative controls come into place, it's about making company policy around COVID-19. It's about making procedures. What do we do if someone is infected? What is the process and how do we do that? So these are often the controls that are probably going to require a team effort to try and develop and look at the intricacies of how business operates, what is the resourcing, what is the worker profile, etc., and come up with some sort of documentation and statement and very pragmatic type of or practical approach to applying that document, because administrative controls are often shoved in a file and nobody reads it, but it's got to be able to be used and read and applied quite easily. One of the biggest ones that you need to probably decide on is obviously have a contingency or business continuity plan. any workplace is vulnerable for an outbreak in COVID-19, and we've seen that in the 2 waves that have passed. The problem is that you might have significant number of workers that become infected at one particular point in time. So there has to be some sort of policy or procedure that guides then what happens both to those workers and then also to the business. And I think you've got to, any business has to work quite closely with the human resources department to look at things like accommodation, to look at things like how is leave going to be applied, to look at things like an employee assistance program. We know COVID-19 affects all of us, both in the workplace and at home. So you have to make provision for a lot of these situations. I think depending on the extent of your business, and that will depend on, number one, the industry you're in, also how big your workforce is, it's going to impact on your capacity and your resourcing. And, you may be in a fortunate position where you have got an occupational health and safety department, possibly even a clinic that can help you do that. But for many smaller industries, the owner and maybe a small management group, hopefully with some sort of labor representation and staff involvement, would be able to come up and design some sort of basic plan on what to do. I think when it comes to COVID-19, you got to almost have separate, you got to address infection prevention and control separately. And I think COVID-19's taught us a lot. And a lot about each of the industries of where the pressure points are and where the exposures are. But you've got to sort of come up with a nice, clear process and procedure and statement to decide on how you're going to deal with infection prevention amongst your staff and your clients coming into your business. I think, like I mentioned, is some companies might have been in a fortunate position. They've got occupational health services to do this, but I think you need to have a good database where occupational health policies on its own can stand up to scrutiny. You might want to look at things like access control. I think it's quite easy to see that now. For example, if you go to many industries and many companies, etc., there's always some sort of access restriction. You've got to fill in a register, etc. And those are the type of administrative controls that will help limit bringing in exposures into your workplace. So perhaps a good access controlled procedure might help control COVID in your setting. I think signage is also important. I've seen many people making distance signages available, and we'll look at that when we come to social distancing. But that's the kind of awareness that needs to be created in your workplace to ensure that both the worker and the client is aware that, hang on, you know what, we've got to be careful of COVID-19 here. I think cleaning of workplaces has also become quite important, and this speaks to both when you have a positive case in your company, but also just general, when you're trying to maintain your workplace and trying to keep it in a good state overall. I think you have to look at what your cleaning procedure is, what are the schedules, how are you doing it, what are the products, etc., etc. And these will be contained or should be contained in some sort of policy or procedure that deals with COVID-19. I think there's a lot of waste that gets generated. Obviously, for example, just touching on the cleaning one, you would have had cleaning products that might have cloths, etc. Masks might have been provided to both workers and clients. How has that been disposed? Is it being disposed of in a careful manner? And I think that needs to be just looked at. You might have to, depending on what you're generating, for example, in the health sector, they might generate specific COVID-related waste. Say for you swabbing a patient, that swab's got to go somewhere. So depending on what type of waste you're generating from COVID exposures, you need to make sure that you comply with the legislation and that you have the appropriate disposals mechanisms. I think it's a good opportunity for workplaces to look at your health and safety committees. Once again, it depends on your size, but it's a nice opportunity now to really strengthen that structure within your organization, because I think they can help you definitely monitor and look at and identify early problems where there are. Make sure that you're reporting correctly. I think a lot has been done, and certainly NIOH has got webinars on certain elements that need to be reported. And this reporting extends both from the time that a person might be positive all the way through to potential compensation, all the way through to actual, like I say, reporting of cases to Department of Employment and Labour. You might have, depending on the business model you're using, you might have to look at your travel policies. At one point in our country, travel was restricted. It then opened up again. And you want your workers to be safe who are traveling on business, to make sure that they are also protected. So you've got to look at and make sure that your administration controls in terms of travel policies are aligned. And then, like I say, I mentioned the EAP program that should be there. I think, for example, vaccines, and I want to just touch here because I think many people are so excited, and or even there's also a lot of anxiety and nervousness. Vaccines do form part of an administrative control, and in some places it's easier to administer because, like I say, you might have an occupational health service that can help you understand and help you guide you through this process. In smaller business, you may have to refer your worker out, or at least try and encourage workers or make them aware that, hang on, there is a national vaccine program that's going on. I can't really speak directly to the actual vaccine because I think the vaccine implementers are doing a great job on that. But I wanted to take the opportunity maybe just to put a few points about vaccines, because I think people are concerned. But it's important for people to realize that, in public health medicine, vaccines are really important, and they've really contributed significantly to how we've managed to eradicate diseases, smallpox being the classical one. It uses medical technology to induce immunity in a person without trying to make the person sick. And, unfortunately, any vaccine can have the potential to cause an adverse effect. But I must emphasize that these are often very, very minor side effects or adverse effects that people experience. It might just be a little bit of pain at the site of, of the injection. That night, you might have a little bit of pain, fever. But these are often adverse effects that can be easily managed. And I think the important message that I just really want to reassure people is vaccines do save lives, that they're well studied, they're well researched, and really, I think people need to, if there's any concerns, you do need to go to the various sites to get the right information, credible information to make a good decision on vaccines. The workplace presents a very good opportunity to speak to workers about vaccines. It's almost like a closed group population, and you can help protect each other through a good vaccination program. I'm going to touch on a couple of slides here, and don't forget that the presentation will be on the website if people want to read it in more detail. But I just want to highlight a few more administrative controls that you might want to just check that you've either got in place or might want to enhance. Training of your workers and keeping them updated. I think I've kind of emphasized that, making sure that COVID-19 information is still at the forefront at the moment. It's a 1 year down the line, people do become fatigued on COVID-19. But I think we're reaching a point now where we can make great strides in trying to fight this battle. I think don't forget about the vulnerable worker. There's good guidance on this from the National Department of Health. Those people with comorbidities, how have you got a program in place that maybe addresses how these workers are dealt with, how they are managed, how they are accommodated? I think that is important. Social distancing in the workplace, like I say, a lot of things have stayed the same from last year. We've still got to make sure that we maintain our distance, because transmission, be it the new variant, be it the original variant, the way in which it gets to infecting people is very much the same. So social distancing is highly important to still practice within the workplace. I've spoken about business travel. If you need to move around in pairs or travel, etc., be careful, apply the right precautions, and we're going to go through a few more of them. Hand washing and toileting facilities, it's become habit, I think, that we need to wash our hands more frequently. I certainly do see people looking a little bit more conscious about it, but I think make sure your workers are aware of this, because hand washing certainly does, it's a very, very good start. Make sure that there's soap and water, make sure that there are facilities to do that for your workers. I think the challenge comes in at remote sites where people are doing construction, etc., etc. Try and put out portable sites where you can and make sure those workers are able to wash their hands. Site access, I spoke briefly about this. I think if you're going to have a business where you're dealing with clients, I think you need to have some sort of control or measure of reducing the risk of potentially infected people from coming into the workplace. Have a policy or procedure so that the frontline person there knows what to do and how to inform the client. Once again, on site, this speaks a lot to more the mobile construction sites, etc. I think you need to look very carefully at how you control people in and out, both through vehicles and through walking. But I think you can read this later on the website. It's just to give you a flag to say, have you considered that when you go to your workplace today? Meetings, I think electronic platforms have become the new norm. Look at the delivery of this presentation. So I think where possible, if you don't have to go face to face with people and you can have meetings, yes, there's advantages and disadvantages, but the issue is COVID-19 exposure at the moment. So look at how you can maybe address meetings and business meetings. We know that canteens and rest areas are high infective areas purely because people go there to relax. They want to take off their mask, and you have to take off your mask to eat, etc. But make sure that you control these areas through social distancing. Make sure that there's hand washing facilities. Make sure that people space out. Sharing food is not the ideal. And you might want to encourage workers to bring their own food, sit together, but bring your own food. You might even want to go outside. Good ventilation, it's sunny. Think of canteens and rest areas, because that's where people do put their guard down and they tend to touch each other and, share things. Cleaning of workplaces, once again, I touched on that. I think you need to have a good policy that speaks to that, both when somebody gets infected and when somebody, just general cleaning. I think mask wearing is the new norm. It's legislated. We've got to wear masks in public, and it's to protect others. I think cloth masks is what's spoken about. You need to make sure that you wash those things appropriately, iron them, and clean them. Can't be used endlessly. You must have a procedure of how to address a person in the workplace if they are infected or you pick up somebody with symptoms. Even if it's a simple procedure, you might have to connect with your local clinic to say, look, can we establish a relationship where I can refer my workers to? You got to decide, but there must be some sort of protocol that people understand that they can immediately access. Don't forget the close contact. If you do come into contact with somebody who is infected, it's usually within 1 meter for more than 15 minutes, and where you might not have had the right masking on you. So if you apply the right precautions in the workplace, you should not have a close contact, because you should be socially distancing and you should be not spending significant amounts of time with each other. If you have to do that in a workplace, in a call center, etc., consider engineering controls, put up barriers, etc. Look at everything to control the exposure. If necessary, you might have to test people. If your workers become symptomatic, make sure you give them a surgical mask, get them off the premises, and recommend that they go and test. Because we will only know if somebody is COVID-19 positive if we do the test. A lot of the symptoms overlap with allergies, flu, etc., etc. But the only real definitive way to know is whether you've actually had contact with a positive person and you've tested positive. Make sure you've got your EAP. It's highly stressful at the moment. So make sure your workers are supported. People have lost family members, they've lost colleagues at work. So you might have to look at a debriefing program or at least some sort of support structure within the workplace. PPE, just very briefly, it's got to be directed by the risk assessment. And I think this will apply mostly in the health industries, etc. But like I say, it's difficult for a worker to wear PPE for very, very long hours. The other thing with PPE, you have to discard it properly. It cannot be taken home because there's risk of contamination of the home. Okay, and that can be read with this presentation on your own. So once again, just to sum up, a lot has changed, but a lot has stayed the same. I think you need to go and look at your precautions, remember the basics, make sure workers are trained, make sure management have policies and procedures in place, and do a risk assessment. And with that, Ashraf, I'm going to stop there so that Gabriel can potentially continue with the risk assessment. Thank you.
So thank you very much for that. That is Dr. Graham Chin, dealing with a very broad introduction to COVID-19 and bringing in some of the more recent developments and important aspects. As is indicated, our two colleagues will now deal with the more specialized technical aspects of the principles of health risk assessment and the risk assessment tools. So just a reminder to everybody, please, our hand-raising facility on our Zoom session it's just not possible. And so I'm asking colleagues who are attending our Zoom session not to raise their hands because you will have to type your question in the question and answer box. Molomoeng Shebi Mahadla, please lower your hand. Boitumelo Isaac Malebo and Isana Wilken, thank you very much. Please lower your hands. So a reminder, the Q&A box is where you need to type your questions for the presenters, and the presenters and panelists will answer your questions in the Q&A box. For additional information, the NIH website, that is www.nih.ac.za, has a wealth of information, presentations, resources, guidelines, as well as full recordings of previous webinars on the website and YouTube channel. With that having said, I need to hand you over now to Gabriel Mizan from the Occupational Hygiene section here at the NIOH on the topic, the principles for health risk assessment. I'm going to ask Gabby just to check his microphone and share his slides while I prepare the introduction of Gabby. Are you checking your sound, Gabby?
Yes, I can. I can
even
check my video if you like to see me.
Thank you. In the meantime, just a brief introduction. Gabriel Mizan, or Gabby, commonly and officially known within the NIH and the field of occupational hygiene, is active in that field of occupational hygiene for more than 30 years, currently employed as an occupational hygienist at the National Institute for Occupational Health, the NIH, here in Johannesburg. His current roles include conducting research, lecturing, consulting, quality control, and managing the asbestos laboratory within the occupational hygiene section here in our building. He worked in private sector as well as the public sector. And Gabby, I'm just going to briefly mute you. And so, in the private sector as well as the public sector, providing consulting services, health and safety auditing, health hazard evaluations, occupational health risk assessment, and management, both nationally and internationally. He obtained a British Institute for Occupational Hygienists, the BIOH, a Diploma of Professional Competence in Occupational Hygiene in the year 2000, and a Master of Public Health, that is in Occupational Hygiene, from Wits University in 2013. He is registered as an occupational hygienist with the Southern African Institute for Occupational Hygiene, SIO as it's shortly known for, since 2000. And he has published several articles related to topics of asbestos, noise, and reproductive health in laboratories. And that brief introduction, I hand you over to my colleague, Gabby. Thank you very much, Gabby, for joining us today and taking time out of your busy schedule. I know you have just spent 5 days training our National Department of Employment and Labor's Enforcement and Inspections Services inspectors. I hand over to you. Thank you, Gabby. If you could just unmute, apologies, Gabby. Early on, I had muted you. Apologies.
Okay, here I am. Thanks, Ashraf, for this introduction, and good morning, everyone. It's really nice to see so many of you online. And I'm really going to talk about the basic principles of health risk assessment. And Graham Chin, Dr. Chin already spoken about control or briefly touched on it. But really, before we can control any hazard in our work environment, we first need to assess the risk. We first need to see what is the risk of that particular hazard. And COVID-19 is no different in that regard. So I will really touch on the basic principles, and the presentation after me will dive deeper into the risk assessment, and will actually present a tool particularly for COVID-19 risk assessment. So trying to navigate here. So in terms of hazardous biological agents, we basically have three groups, animals, plants, and microorganisms. Our focus really is on microorganisms, and also our hazardous biological agents regulations in South Africa really focuses on microorganisms. So before we start with the presentation, I would like you to do a little exercise. There's a lot of people online, but let's see if we can manage it. Here are some causes of death in South Africa. What I would like you to do is to look at this list and try to rate those kind of causes of death, from the most serious one, in other words, the one that causes most death, to the least one. And if you don't mind, I would like you to type in the chat box, and don't give me the whole list, but perhaps you can just type the first three that you think, in order of priority, that you think is most hazardous to the least hazardous currently in South Africa. So I'm not sure if I'll be able to see it, what you're writing. I do see the Q&A, but perhaps as you type, I'll be able to see. Otherwise, I'll ask Ashraf to just read for me what you're typing. So
Kelly has said MVA, Marlies has said AIDS, Willie has said heart disease, Marlies has said cancer, Maureen has said motor accident and then cancer, Liesel has said murder, Lulia has said motor accident, William TB, Jan Visser, COVID-19, Annalie, heart disease, COVID, cancer.
Okay, thanks, Ashraf. Yeah. I think that's enough. That's fine. And so this is some information that was published in early April 2020. Well, published, it was actually on social media. And that's why I put this big caution at the bottom. So I didn't have really a way to check those figures. But what we all do remember is, at the beginning of the pandemic, we had very few deaths from COVID-19. At that point in time, there were 3. And compared to other causes of death, that looked very small and nothing to worry about. But what I want to demonstrate with this little exercise that we did, as well as these figures here in the graph, is a few things. First of all, is that our perception of risk varies between one person and another person. And it depends on many factors. It depends on what knowledge we have at that point in time, what experience we had. You know, sometimes we have gone through a motor accident or whatever, and then we tend to think this is actually very serious. Or you know, we had a snake bite or whatever happened to us. So this is also going to affect our judgment, our culture, our background. It's all affecting the way we perceive a risk. The other thing is that we need to understand about risk is that risk is not constant. Risk changes over time. So what appeared to be negligible, say on the 1st of April 2020, is now a very serious risk. So that means that the risk assessment is a continuous process. It's not a one-off thing that we do in one point in time, but we also always need to assess the risk. And when we do a risk assessment, we're not only looking at the current risk, but we also have to look at the projected risk. In other words, what we think is going to happen with this virus or with this hazard in future. So really a risk assessment, we're trying to get information and to be objective so we can then go on and do what Graham has shown in his presentation and take all the measures that we can in order to control the risk. So what is a health risk assessment? It's an information gathering and review process leading to valid and informed judgment about health hazards and risks. It's about managing the risk, in other words, taking steps to achieve and maintain adequate control. A risk assessment also helps us to decide what needs to be done in terms of monitoring the risk and health surveillance program, like for example, audiometric test or any health surveillance program that we apply in the work environment, chest X-ray or whatever it might be. Now, when we talk about health risk assessment, there are two concepts that sometimes get confused, and it's important for us to understand the difference between those two concepts. So one is a hazard and the other one is a risk. So what is a hazard? That's the capacity or potential to cause harm. It relates to intrinsic properties of the process or the substance, and it tends to remain the same. A risk, on the other hand, is the likelihood or probability that the harm will occur. It very much depends on the circumstances and it varies. So let's take a simple example of crossing the road. What is the hazard when we cross the road? The hazard will be to be knocked over by a car. Okay, it's not about getting eaten by a lion. The hazard is the same. But the risk, what is the probability that that's going to happen, will change, will vary a lot, depending on the circumstances. So questions that we can ask is, for example, is it a busy road, a quiet road? Is there a robot? Who is actually crossing the road? Is it an old man with a stick, or is it a young boy? So all those kind of things we need to consider when we look at the risk. So when we talk about hazardous biological agents, there are different hazard groups, and this is really relating to our hazardous biological agents regulations. And we classify the various microorganisms into a hazard group depending on what is the seriousness of the disease that it causes, how probable it is to spread into the community, is there any effective treatment for this type of disease. And until not long ago, I think we all tend to put SARS-CoV-2, which causes COVID-19, into hazard group number 4, because it causes serious human disease. There is a high risk of spreading into the community. And at the time, there was no effective treatment or prophylaxis for this virus. I think now it might move up, maybe to hazard group number 3, because now we do have treatment, I hope. But this is still maybe debatable. So when we're doing a risk assessment and we're looking at different risks, okay, COVID-19 can be one of them, we need to have a process to look at those risks and somehow prioritize the risks. Try to figure out which one is more serious and needs more attention, and which one is less serious or negligible. And the two things that are really important where we come to calculating a risk is very simple. One is the severity or the consequences of the exposure or the health hazards. So what are the consequences if I'm exposed to this virus or whatever it might be, to noise or any other hazard in the work environment, asbestos? And then the other question that we need to ask is, what is the chances, what is the probability, what is the frequency of exposure to these particular health hazards? So risk is really a combination of the hazard and the exposure. So we can plot our risk or put it in a matrix where on the one hand we had the health hazard rating. So this is one example of a risk matrix. There are many different ones. There are more complicated ones with many different numbers. This is a relatively simple one. So we give the health hazard a rating. So we look at something at, say, exposure to SARS-CoV-2, which causes COVID-19, and we ask ourselves, what is the health hazard? I think a lot of us will probably go to 4 or a 5 hazard rating. It's quite serious. And then we would look at the exposure rating. So what are the chances that, sitting at home, in my office home, that I'm going to get exposed to the virus compared to, for example, being in a busy shopping center, let's say not wearing a mask. So the exposure rating is going to be very different again, depending on the circumstances. And we can do the same thing about vulnerable workers, or in general, workers in our workplace. So for example, a healthcare worker compared to an office worker will be in a different risk group. And also we can look at vulnerabilities. So let's say a healthcare worker who's 60 years of age and has got diabetes will be falling in this matrix in a completely different place than a young worker sitting at home, or whatever the case might be. And Dikeledi, the presenter after me, will dig into this in more detail. The basic steps in a workplace risk assessment are really very similar if you take COVID-19 or if you take any other agent or stressor. We will go through similar steps. And first of all is really identify the agent and assess the hazard, okay, the seriousness of this particular exposure. We need to look at what is happening in the workplace in terms of activities and processes. The next step will be really to prioritize the risk. Is it a high, medium, low? Maybe we give it a number. Next, we're going to implement some control measures to mitigate the risk. And then we will have a process of evaluation and review. And as you can see, it's not a straight line, it's a cyclical process, and that links to what we've demonstrated earlier on, that risk assessment is a cycle, it's an ongoing process, it never ends, and it can only lead to improvement in the health and safety of workers. So Dr. Graham touched or spoke quite a bit about the hierarchy of control. So this is standard practice in occupational hygiene and in occupational health in general. When we look at controlling a risk in the work environment, first of all, we look at elimination or prevention, and that is first prize. If that's not possible, and often it's not possible, We're going to look at engineering controls. We're going to look at ventilation. We're going to look at containment and so on. We look at administrative controls, what training, SOPs, signage we can put in place to reduce the risk. And then the last resort is personal protective equipment. If all the other measures are not sufficient to mitigate the risk to a level which is acceptable, then we have to use personal protective equipment. And we all know, just looking around, of people not wearing masks and the way they use the equipment, to understand that PPE is never the best option to control a risk. When we talk about hazardous biological agents, we often talk about the chain of infection from the pathogen to the host, can be a human being. There are different steps. And if we can break the chain in one place, then the infection is not going to happen. And there are different interventions that we can apply at different stages, like engineering controls, work practices, our PPE, and immunization, as we all know. I just want to really touch on a few guidance documents that came out recently from government, particularly dealing with our emergency situation that we're dealing with COVID-19. This is the first one. It's all available on the internet. It's called Specialized Health Risk Assessment for Workplace. And really, I just want to first say that we do have a document which is called the Hazardous Biological Agents Regulation, which I've mentioned already, from 2001. This is really the basic for what we do in the workplace in terms of controlling the risk from hazardous biological agents. Now, the same principles still apply today. They haven't changed. So this particular directive really reiterate and emphasize a few points that are already touched upon in the hazardous biological agents regulations. And I'm not going to go through all the details, but just give you a few things. For example, the need for information sharing. So when we do a risk assessment, we need to involve our health and safety representatives and committees in that process. We also, any risk assessment that we do, we need to have some kind of written record of that assessment. And this is some of the things that we need to keep on record. There's also this issue about a competent person. So often the question is asked, who can do this kind of risk assessment? And the hazardous biological agents really speaks about a competent person, but doesn't really give explanation who is a competent person. So this directive sort of expands a bit on this topic, and it says that a competent person needs to be somebody who's familiar, who knows this process of health risk assessment, is also knowledgeable about the regulations, the hazardous biological agents regulation. He needs to understand about this particular health hazard, which is called SARS-CoV-2 that caused COVID-19. Now, nowhere in the regulation it says that you need to invite a consultant or a special person to do the risk assessment. Anyone can do it, any competent person can do it, but it is advisable that you consult a safety professional or a registered occupational hygiene in that process. Again, the issue of hierarchy of control is emphasized in this directive. So particularly for COVID-19, we have the standard precautions that we all know about: hand washing, sanitizing, social distancing, personal protective equipment. And also we have the transmission-based precautions, and this is especially important for laboratory environments, where there are processes where they can generate aerosol when the exposure risk might be enhanced. And like we mentioned earlier, there needs to be a process of reviewing the assessment on a periodical basis, or if we have any sort of indication that the current process is no longer valid, then we need to review the process. If anything changes in the work environment that can affect the risk, we need to redo our risk assessment. If we have any cases of diseases, ill health, then it's time to relook at our risk assessment. And like we say again, it's an ongoing, continuous process. There is another directive that came out, and this is already last year in May, and it's called COVID-19 Walkthrough Risk Assessment. This is another tool to really help us to do the risk assessment. It's built in a form of a questionnaire. So we have various topics that are covered, from education, training and awareness, hygiene measurement, physical or social distancing, engineering controls, administrative controls, PPE, safe work practices, waste management, safety equipment and emergency response, all those. And I'm not going to go into detail about them, but this is again freely available. It's a very easy, straightforward, simple tool to use with a yes/no kind of answers, and that can help us a lot when we come and do a COVID-19 health risk assessment. So what are the areas that we need to look at? There are priorities areas where there's more chances of contact, of getting exposed to the virus. Places like the workplace entry and exit point. We all know that often in these areas, that's where we monitor persons for symptoms, or we take the temperature readings. Change house facilities, canteen, dining areas. Again, Dr. Chin has mentioned. Waiting areas, conference, training areas. These are all places that when we do a risk assessment, we really need to focus on these particular areas. I just want to speak a little bit about the problems that we have with hazardous biological agent risk assessment. And this is not just for COVID-19, but any biological agents that we need to do a risk assessment. Unlike chemical hazards in the work environment, where we have occupational exposure limits, in other words, we have a maximum limit that we are allowed to expose any worker in the work environment. There aren't such limits for hazardous biological agents. And we all understand why, because biological agents, today we can get one and tomorrow we can get 1 million, because they propagate, they duplicate. So in other words, we can't rely on a certain level to be safe. There are no exposure limit. Hazardous biological agents, unlike other common workplace hazards, are really common in the environment. So we find them everywhere. In fact, we have viruses, we have fibers, we have pathogens floating everywhere, and we are all exposed to it. Of course, what matters is the dose. So our body can deal with a certain amount of viruses, of fibers, of particles, and that includes SARS-CoV-2. We can deal with it. But when it comes to a certain dose and nobody knows exactly what that dose is, then is where we might get the risk of getting the disease. There are still uncertainties regarding the routes of exposure. So we don't know exactly how much hand contact, compared to breathing it in or ingestion or whatever. We don't know exactly the relative risk from exposure in the different routes. We have individual susceptibility of vulnerable groups and of workers, and Dikeledi, the presenter after me, will touch more on that. So we have this problem of comorbidity of people that are immunocompromised, that have all kinds of other conditions that might expose them, and they might be at a higher risk than other workers. We also have to think about that there are limited resources for risk mitigation, and we've touched on that also in the previous presentation. There is so much money that we can throw at the problem, and we really have to do it in a very cost-effective way when it comes to risk control. So guys, that's the end of my presentation. What I wanted to ask you, if you could, in the chat box, just put one word or a very short sentence answering these questions. Why do you think we do a risk assessment? So Ashraf, maybe you can help me with some answers. Don't think I can see the chat box.
It might be in the, Gabby, in the little panel at the top or at the bottom. There's an additional three dots on the right-hand side, and then the chat function is there. But quick comments that I can see here now. Ooh, it's coming very fast.
I can see it.
Yes. I think I've missed out on a few.
Risk assessment, ensure risk, establish control, yes. Safety in the workplace, determine the likelihood, to control the risk. Okay, guys, this is my answer. This is my word. And I think you've all answered correctly, just maybe in a few more words. Thank you. I really appreciate your attention. Thanks very much.
Thank you very much. And that was Gabriel Mizan from the Occupational Hygiene section, having dealt with the principles of health risk assessment for us in today's webinar. I'm immediately going to go over to the next topic, the risk assessment tool. And our presenter and facilitator here is Dikeledi Matuka, who's a leading member of the Immunology and Microbiology section in the NIH. And I'm going to ask Gabby just to unshare his particular slideshow and ask Dikeledi to share hers. And by way of introduction, Gabby will just unshare. Thank you, Gabby. By way of introduction, and I'm going to ask Dikeledi if she could just, there we go. And for the full screen, Dikeledi, we'll test your audio in a moment. So, Ms. Matuka is a senior medical scientist at the National Institute for Occupational Health and holds a joint appointment as associate researcher in the Department of Clinical Microbiology and Infectious Diseases in the Faculty of Health Sciences at the University of Witwatersrand, or WITS shortly. Onika is involved in services, including workplace assessments, research, teaching and training, and advisory or consultations on biorisk management. Her major research interests are bioaerosols, respiratory and infectious diseases in the field of occupational health, with specific focus on indoor air quality, infection control and prevention strategies for occupational exposures to biological hazard biological agents. And Annika is registered with the Health Professional Council of South Africa, the HPCSA, as a medical biological scientist. She's a member of the NIH Research Committee and was previously a member of the ultraviolet germicidal irradiation. Let me do that again. Annika is a member of the NIH Research Committee and was previously a member of the ultraviolet germicidal irradiation, that is a UVGI task team. She's actively involved in occupational health research and training for undergraduate and postgraduate and occupational health professionals. Ms. Batuka has 17 years experience in occupational field and has presented at scientific forums, seminars, and conferences, both nationally and internationally, and has published in both peer-reviewed and non-peer-reviewed journals. With that short introduction, I'm going to ask Dikuledi if she can just check her microphone for a moment. I can see your slide is fully occupying the screen.
Hi, Ashraf. Thank you so much.
Thank you. Please proceed.
Everyone. Good afternoon, everyone. I'm just going to go through the biorisk assessment tool. And I just want to mention that this is a generic tool because there is no standard tool for risk assessment. And so we're using this just as a guideline to guide you. You may already have a tool that you're using. So this is just to check if you have taken into consideration the most fundamental components that are needed when assessing exposures of hazardous biological agents. It is important to assess the risk because the tool, it helps to identify potential problems or gaps and also forms basis of the control measures that are needed in the workplace. So I'm trying to get to the next slide here. Okay, this slide basically summarizes the steps that needs to be followed when doing risk assessment. So firstly, when doing risk assessment, one needs to anticipate the risks because the risks can be found everywhere. So once that has been achieved, then the first step of risk assessment is to identify the risks. So there you will start by looking at the source, the main source of exposure, of which in this case is your SARS-CoV-2, that's your agent, it's a virus, or it can be indirect by other sources which are contaminated with the virus, such as your body fluids, the infected person on its own, the surfaces or objects that has been contaminated with the virus. So that's where you identify your risk. And the second step is to look at the transmission route. So as we currently know that SARS can be transmitted via contact, either with the infected droplet, or it can be airborne. WHO has acknowledged now that there is possibility of airborne, although it's mentioned that there's not enough scientific evidence. And then it can also be through contact with contaminated surfaces, as I've mentioned. So once that has been identified, now your focus will be on who shall be harmed from exposure. So you have to make a decision. Now you look at your employees and the type of job that they do. So you look at different occupations within the workplace. Then you list that accordingly in your tool. You'll see on the next slide, I'll give an example on how you go about it. So because there are different job activities, and for those people, the risk profiles will differ. That's why it's important to split the jobs and also look at the risk factors that can predispose employees to exposure to this virus. So the previous speakers have already mentioned that you look at your elderly people because those are more vulnerable compared to healthy individuals or your young workers. Also, you will look at who has comorbidities in your workplace. And I've listed on my left corner there the examples of comorbidities. So that will form basically the part of your risk assessment of vulnerable workers. As you conduct this overall risk assessment, you need to incorporate as well the risk assessment for your vulnerable workers. And then you also look at exposure period. Although there are no occupational exposure limit for hazardous biological agent, it has been shown that the longer you work, the more exposed you will be as compared to someone who will work for a shorter period of time. So that is also important. So exposure can also be semi-direct via contaminated hands. That is why there's measures that has been put in place that we wash our hands at least for 20 seconds or use hand sanitizers where possible. So the other fundamental pillar that is of interest is your environment, because the virus can settle on any surface, and as we touch different surfaces as well, we can possibly contaminate that. So we need to identify high-risk areas within our workplaces and also look at the high-touch surfaces, especially those in the communal areas that we share within the workplace, such as your bathrooms where you share taps, in the tea room or in the kitchen, we share microwaves, we share fridges. So we need to take all those into consideration as well. I also want to mention that risk assessment is a multidisciplinary effort. Why? Because we're dealing with many factors involved here. For example, when you look at the environment, you will need, for example, your ventilation engineer, as we know that for environmental control or engineering control, you need adequate ventilation in order to dilute the concentrations of the virus within the workspace. So the engineer will advise and will determine whether if you're using local exhaust ventilation, whether it's adequate. Otherwise, you use natural ventilation, as it has been shown also to be as effective as your mechanical ventilation. You may need also an occupational hygienist. You may need an architect for building design. We know most of our buildings are not user-friendly or are not built for that purpose, because people started purchasing buildings and then they only find out later that they are not conducive for the work environment. You also need a medical professional, because when you have infected workers, there's someone that needs to look after the workers as well, health-wise. So that is why it's encouraged that you have a team of all expertise in order to reach a common solution or common goal in order to prevent exposure and protect the worker at the same time. So after conducting risk assessment, it's important to record all the findings. We go to workplaces and we ask if risk assessment has been done, and we found in most of the workplaces, people say they have done risk assessment, but when you ask for a record or report, they don't have the report. So it is important to record the findings, because it also helps you to track on the progress if you have mitigated fully or if there's some other points that needs to be addressed. And then once you have identified the risk, you've decided on what control measures need to be implemented, then you implement them, and then you have to keep reviewing the risk assessment, especially with changes. Like if you have all seen now, we have moved from level 1 to level 2 to level 3, and then we came from 5 to 3. So with that, there are changes, so you need to review it. Although the Department of Employment and Labor has recommended that risk assessment be done every 2 years. Yes, it must be done every 2 years. And when there is any change in your workplace, you'll find out that you also may need to change a machine, for example, in your workplace. If that comes into place, it changes the dynamics in the workplace. So you need to review to see the impact of the new instrument or the renovation that has been made in the workplace. And then one needs to also keep updating risk assessment whenever it's necessary. So I'm not going to go into details into the hierarchy of controls. Dr. Chin and Gabi has gone through this. Here, I just wanted to highlight that it's important when implementing the controls that you follow the hierarchy of controls. Yes, with hazardous biological agent, we cannot eliminate the virus because it is impractical. Microorganisms are everywhere with any other microorganism, including the SARS-CoV-2. So but there are other alternatives that can be followed. And the most common elimination now is just to avoid being in contact with a person who is symptomatic, because that you will know if the person is sick or have been tested positive, then you know you have to keep a distance from that person. Otherwise, in the job, we can apply other measures that can help us to reduce or substitute to minimize exposure, such as your job rotation or having shift work in the workplace, that or having people to work remotely, etc. And then the administrative, the first step is to do risk assessment, because that will help you identify the problems, as I've mentioned in the previous slide, and then look at your vulnerable workers as well. Have policies in place, as the previous speaker have emphasized, keep social distancing, and make sure that staff are trained, because it's important to train staff that they understand what policies are in place so that it's easy for them to comply, and because they will have an understanding of why they need to comply or adhere to the set procedures and policies. All workplaces are expected to provide sanitizers, and awareness campaigns are also important in order for the workers to be updated with what's happening in the workplace. For engineering controls, it's where you'll have barriers or demarcations in order to keep social distance between the workers, as well as washing facilities for your hand washing, as well as disinfection of work surfaces. The other pillar of that's important, that's not commonly reported when mentioning hierarchy of controls, but we thought it's important because when it comes to COVID-19, behavior is a critical component, because you can have all policies in place. You can provide sanitizers, you can screen the workers, but if they are not compliant, then it doesn't serve any purpose and people will still be exposed. So behavioral change, it's something that we should focus on and ensure that our workers like they cooperate and they are compliant with whatever management have said in the company. And lastly, your PPE. For now, we know that masks has to be worn in all public places, including workplaces. And then you have the gloves that shouldn't be worn by everyone, only those who need them. So your risk assessment will inform you of who will need to use gloves in the workplace, such as your cleaner will need the gloves because of the type of chemicals that they will be using for cleaning, and they have to use the particular gloves that can withstand the harshness of the chemicals that they use to protect their hands as well. And then you may need other PPE For example, for your first aiders, if there is an emergency in the workplace, with COVID-19 now, we have to take strict precautions. So you have to ensure that your first aiders are fully geared with the necessary PPE. You may need your aprons if they need to probably be touching, because to help a person, they need to be coming into close contact with the person. It's difficult to keep social distance in that instance. And then just to highlight also that masks does not replace social distancing. Though we're still wearing masks, we must still keep social distance. And also, while wearing visors or face shields, workers are encouraged also to still wear their masks, because your face shield does not prevent the air particles from being expelled in your nose or mouth. So I've seen many people wearing visors and not masks. So if they wear visors, they must be encouraged to also wear their masks in order to keep the particles. So the Department of Employment and Labor came up with categories grouping different risk groups based on exposure. So these are just the 4 groups that they have came up with. So for very high exposure group, those are the ones that are conducting aerosol generating procedures, those that are handling COVID-19 samples, as well as examining the cases or people under investigation. Those are known as your COVID-19 suspects. So all those people are categorized as very high, and mostly there will be your healthcare workers as well as laboratory workers. And the second group will be your high risk group. Those are also your healthcare workers, including their support personnel, such as your emergency response, those who works in ambulances, the mortuary or for forensic staff, and other staff, healthcare workers that are working in the wards as well as the porters. Whereas your medium will be all the facilities that handle high volume people, such as your retail shops, your home affairs, your police stations. And in those facilities, it's likely that people come into 2-meter distance with people, or there's unknown people who, or asymptomatic people who may pose a risk in those settings, because it's the settings, usually you get basically a group of people with unknown status, basically. And the last group will be your low exposure group. Those are defined as the ones that have no contact within 2 meters with the COVID cases or suspects. So they have minimal occupational contact with either the public or their co-workers. So this is just a slide showing that after conducting risk assessment, it needs to be evaluated. So Gabby has covered this slide. So here I just wanted to highlight that there is quantitative assessment or qualitative. So the quantitative one is the one that will use your risk score. So some sectors have already the tool that rate their risk based on the score. So you'll have the numbers and the scale on which you'll categorize low. You'll say, for example, it's between 0 and 6, and medium between 6 and 12, and high probably from 12 to 16, and so on. So that's the difference between quantitative and qualitative. Qualitative is just when you measure by observation and looking at the likelihood of exposure, as well as the consequence or the outcome thereof, whether it's severe, moderate, or negligible. So based on that, then you decide on how you rate the risk. And then your actions that will be taken will either be based on the risk score or the qualitative one, or whether it's medium, low, and risk, low, medium, and high, sorry. And then priority must be first with the high-risk areas, and also it must be based on the agency, depending on how urgent and the likelihood of exposure or the severity that it can lead to. That should be also prioritized. And it will also depend on other factors. For example, if ventilation is one of the control measures that needs to be implemented, it may take a while because you need to source out an engineer to come and evaluate the building, and there may need to be some procurement processes in place. So when setting the timelines also, that I will explain in the tool, because you need to have an action plan after doing risk assessment. So you need to be set reasonable timelines based on the need of resources, or how quick the mitigation strategy or mitigation thing can take place. Okay, so this is basically the tool that we'll be going through together. I've mentioned that it's just a generic tool, just highlighting the important things that needs to be into your tool, but you may have other factors or other items that you may need to add based on your sector. I was told with the initial invite that this workshop or this was directed for the judiciary. So I just made an example based on that. But as we go through the tool, please think of the activities that you have in your respective workplaces and see how you can apply this on this tool. So here I've just listed a few, such as your registration when you get to either the courts or any other building. The first point of action, you come into contact with security. So at the registration, you look at who will be affected. Remember in the first slide, we did say, after identifying your source or your source of exposure, which is SARS-CoV-2 in this case, you decide on who may be harmed or affected. So you look at the job type, who may be at risk. So at this point, at registration, it will be your security or your registration clerks, whoever sit at the entrance will be at risk. And then we already know the route of exposure for SARS-CoV-2, and we know what it leads to, COVID-19, which present with different symptoms. And then you look at your existing controls. We refer to them as baseline controls in this sheet or in this tool. So you will list all the controls that you have already in place. If you have done risk assessment, you list it here, policies, sanitizers, if you're keeping social distance by now, I'm sure everyone has implemented this, wearing of mask, adequate ventilation, all that will come onto the baseline controls. And whatever you think is lacking while you're doing your observations or assessing while doing your walkabouts, then you'll add into residual, whatever you don't have. If you haven't done your assessment for your vulnerable workers, you'll put it here. And then you look at whether you will need washing facility there. At security point, it's unlikely that you'll have a washing basin. So there, your control will be a sanitizer. Whereas for other jobs that have access to water, then you can put a wash basin as your control. So you ask yourself also, do I need to give the securities that gloves? Do they really need securities? So you have to determine now, if I give the securities gloves, they are dealing with different people. They are searching bags, they are storing like your guns and things. So they're dealing with different people. By giving them gloves, it will mean they will be touching this item, moving to another item, moving to another item. So in that way, indirectly, they are spreading the contamination. So the exposure is likely to happen. So the safest way is not to provide gloves for this type of job. Rather, give them sanitizers. They must sanitize between each person as they touch different objects, they must sanitize rather. If you are going to provide gloves, it means they have to change gloves in between, which is not a cost-effective exercise. So I'm just indicating here, while putting control measures into place, check the practicality and also the risk of further transmitting or spreading the virus. So, and then the next one here is example is presenting evidence in the courts, for example. So there, the source of exposure will be your papers, your pens, because you have to exchange pens and papers. And the risk groups will be those people that are involved in those processes. And so you'll have almost similar measures in the same environment, but again, check which one applies and which one may not apply for that group. And then recording of proceedings, for example, if they're using a recorder, a portable recorder, which needs to be changed between staff, so that can be a risk as well. So you need to find a way of making sure that between the different workers, that there's no transmission, or look for other alternative methods that avoid exchange of the tool or exchange of any item. So you can look at automated system or whatever is available in the market. So during court hearings or trials as well, because sometimes the public come in, there are visitors, those who come to support families and stuff. So that also is a risk because there are many people coming outside into the work environment. So workers may be exposed to external factors as well. So now we know visual meetings or online platforms are commonly used now as a means of controlling exposure to this type of settings. Also, if there is no possibility of doing online, rather restrict the numbers of people coming or shorten the time periods that people get to spend within the environment, and ensure also that in those settings, there's adequate ventilation as well. Fresh air supply is important in this case. So I've mentioned in my previous slides that an action plan needs to be put in place because we need to mitigate this risk. So we have to allocate the people who will be responsible for looking into this, addressing this outstanding or into these gaps, and then put timelines, because timelines will help us to determine how fast we can do this, especially the urgent ones. You don't want to be exposing the worker for a long time. The sooner, the better that measures are put into place. So for now, I've rated this as medium risk because of the outstanding or residual controls, if there needs be, that needs to be put in place. But in your settings, if as you go about assessing the risk and you implement whatever is outstanding, that is going to drop your risk to your low risk. So the more control measures you put in place, the lesser the risk. The next example is of administrative job. Document control, I've mentioned exchange of documents for admin clerks and office workers or HR. That's also, those are your risk groups, or for IT staff that are responding to calls to help them with setting up or fixing their laptops or PCs. And then during lunch breaks as well, although it's not a job as such, but we do have lunch at work, and that's unavoidable because we share tea rooms. So we need to encourage staff not to share the food, and also determine based on the size of the kitchen that you have, how many people at a time can go into the kitchen at a time, so that we avoid overcrowding in that room, and people must use their own utensils. That's recommended. Although we may have the basin there and soaps, people can still wash their utensils, but it's recommended that each person use their own. And then during training of staff or meetings, there's a risk of exposure to between workers. As we all know, I've mentioned that people may not be showing symptoms, and asymptomatic people have been shown to also spread the virus. So we have to work with a worst case scenario to say, look at every person as infected, although they are not infected, in order to protect ourselves. That's the safest approach we can follow. And then during the audits as well, auditors or compliance officers or visitors that are coming to check the workplace also can be at risk. So workplaces are responsible to protect both their workers and their visitors that enters their buildings as well. It is a requirement by the regulation. And then the last one is travel. I've added travel here because some of our employees uses public transport, although it's not work-related sort of, they can bring the exposure into the workplace. So when you do risk assessment, especially the vulnerable worker one also, look at your employees. Those who are using private cars are more safer compared to those who use public transport, because we've seen now our taxis, although social distance is recommended, taxis don't do social distance, so the risk of exposure also there is higher. So those workers that use travel can bring the exposure into the workplace, as I've mentioned. And those workers that share their private cars also must still maintain other non-pharmaceutical measures that are put into place, making sure the windows are open, making sure they wear their masks if possible, have fewer people in the cars, unlike filling the entire car with four passengers. So you look at the baseline controls. This is the same principle applies as I've explained in the previous slide. And then you look at the residual and what needs to be upgraded or added. Then you'll rate your risk based on that. As mentioned, the more control measures you put in place, the lesser your risk. So for housekeeping, every workplace will have a cleaner. So there are risk factors also to the cleaners as well, because they are in contact with colleagues or other employees, because they go into each office to clean offices, to clean communal areas, the shared spaces, and so on. And so they can be exposed to contaminated surfaces or equipment, as well as infected colleagues or co-workers. So by controlling exposure, we'll also look at possible measures that can put into place. I've mentioned that the cleaner must also be provided with domestic rubber gloves to protect them. Most importantly in this category is that the cleaner must be trained on the type of detergent or disinfectant that they use. The dilution of this disinfectant is important, because the correct dilution helps in activating the virus on surfaces. So they need to be trained on that as well, to know how much they should put in how much of water if they need to dilute that, because if they're not doing the correct, making the correct dilutions, that may impact in the possible exposure as well. And then also they must be trained on policies, and there must be refresher training all the time, and records must be kept of the training of workers as well. And most importantly also, although the talk is on hazardous biological agents, there are other direct, indirect exposure because of chemicals they use. They must also be trained on the safety data sheet of the chemical they use. They must know the health effects associated with the chemical or the disinfectant they use. So you get security as well. I've mentioned that, or as an example in the previous slide, they come into contact with many people, they touch many, the handbags, they exchange IDs, or they text, some uses the text or for visitors. So those are the sources of exposure. if where possible, items such as this, I don't know what this is called, but it can be used for searching instead of touching by hands. And also for those that use the remotes for gates, because of the shifts between securities, there must be procedures in place in order for the decontamination, so that each security, for example, they must know when they finish their shift, they must decontaminate all the surfaces, especially when they share this booth, contaminate all the surface, contaminate the remote that the other will use, and so on. So workplaces must ensure there's procedure in place. Where possible, have checklists to show that they did do the checks, so that we know in order to minimize exposure, thus minimizing the cases in the workplace. And if possible, when grouping the shifts, you can have same people in one group as shift. That helps to avoid, in case there's a case or transmission, not all the securities must be affected. At least you will know it's only this group. Then you still have a backup system, like a backup group that you can put that didn't come into contact with their other colleagues. So there are mistakes that are commonly made when doing health risk assessment. Most people see risk assessment as a once-off process because they just want to have something in place for when the inspectors come from the Department of Employment and Labor, for example. So this should be a continuous process because it's helping us to identify the gaps and to close those gaps that are existing, thus protecting our workers. And it shouldn't be seen as a paper or tick box exercise. The person must physically go into the workplace or the area, see what the person does, and see the likelihood of exposure or of transmission in those work areas. And workers must also be involved, because the person doing a risk assessment may not be so much familiar with the type of activities that each type of work does. So the worker may help you with additional information on what they do, which may be helping you to see something that you overlooked, and that will help you in when you have to put control measures in place. And workers are also encouraged to report, because that will help us to catch the infections on time, thus minimizing exposure in the workplace. And I've mentioned that risk assessment must also be documented. We've seen some have been outdated, like it was done like 3 or 5 years ago. So it has to be, it's a working document, actually, risk assessment. And then sometimes the risks are not assessed fully due to lack of competent staff. As Gaby has mentioned, the requirement for competent staff is someone who has to be knowledgeable about the regulation, has to know how to conduct risk assessment, and most importantly, have to have microbial background, because not only for SARS, because microorganisms differ. You have different categories and they behave differently. So it's someone that needs to understand the microbial component, or how the microorganisms behaves. And then lastly, preventive hierarchy should be taken into consideration. So risks must also be communicated. It has been highlighted by this previous speaker, but here I just wanted to mention that it must involve everyone. It must involve management, because they are the final decision makers when it comes to policies. Management also provides resources. If you going to have to upgrade your ventilation system, for example, or to buy sanitizers, you need a budget for that, and management has to know, to be aware of what's happening. Workers need to know of their risks and hazards in the workplace and the outcome that can lead to, and how the employer is protecting them, and what their role is also. They need to be informed on that. External advisor can be sought if there is no in-house expertise as well. And also, there are different committees in workplaces. As we visit workplaces, we've identified that, And then the challenge here is that some committees are working in like on their own, and you'll find out that some activities overlap. So you'll have like bits and pieces everywhere. So we usually recommend that these teams must work together because we have a common goal. And then we know it will save us the cost also, because your bio-risk management committee will be looking for a budget on the side. Your occupational will be looking for a budget on the side. Your infection and prevention and control committee will be. So if we work together and identify the common things, we can work together and save the company cost by buying bulk stuff, for example, like your sanitizers and other common things. Then we save the company. It also helps us in progress, you know, to mitigate those risks in the workplace. The other point is also to consider other COVID-19 risks. Although they are not related to biological agents, they are indirectly impacting in the workplace. Because we have to disinfect our workplaces, there's potential chemical exposure to the chemicals we use. Even the sanitizers in our workplace, we've identified a few staff members that didn't react well to some hand sanitizers. So we had to look for alternative sanitizers for them. The soaps that we use in the bathroom, some were reacting, we're getting allergic reactions to that. So we had to find mild soaps for them to use in the workplace. So the main aim here is to also protect the worker, even though it's not COVID related, like biological agent. Some other measures that we put in place can impact on the health of the worker as well. Mental health, it all affect us because of this unprecedented circumstances. We are under a lot of pressure. We are working in an environment that we are not used to. It can affect the workers as well. Ergonomics, because we have to now change our work environment. We changing our workstations and so on. That can impact as well as overall business continuity. That can be a risk as well. So management has to also look at that when doing risk assessment. So in conclusion, we need to prepare, to plan and enforce in order to protect the health of the workers. And we can do that by anticipating the risk and identifying exposure for workers and record those findings, as well as review regularly the risk assessment. And we mustn't forget to conduct the risk assessment for vulnerable workers, because they are more at risk as compared to your healthy individuals. Each workplace must have policies in place for both workers and public. They must understand what guideline or policies to follow when they enter the work setting. And then mitigation strategies needs to be implemented where necessary by following hierarchy of controls. And we must all be vigilant and informed with the changes that comes in. We must keep updating ourselves with new information, as well as update the risk assessment with changes that takes place in the workplace. And most importantly also, we have to communicate the risk to inform the workers as well as our visitors in the workplaces, and inform other co-workers of possible exposure, although that must be done also while ensuring confidentiality, and encourage staff also not to stigmatize those that have been affected or infected. With this, I would like to say thank you.
Thank you very much for that. And that was Dikeledi, commonly and officially known within our ranks as Anika Matuka, who's a leading member of the immunology and microbiology section. And she has dealt in thorough detail with the risk assessment tool that you all need to be familiar with in order to ensure that your workplaces and everybody else within your workplace that plays a health and safety function must be familiar with, to ensure that your risk assessments are fresh and completely up to date for 2021, given all of the developments that has been shared with us by our three colleagues, Dr. Graham Chin, Gabriel Mizan, and Dikeledi Matuka. We only have a few minutes left for the questions. Our colleagues have done quite well on the Q&A ones there, and there have been some general admin things people raised there unnecessarily. But I'm going to ask Gaby and Annika if they could just briefly for 2 or 3 minutes each, having looked at the questions in the Q&A box that have come through and questions they've answered, what is the key summary points they would like to share with us as the attendees? And we've been almost over 1,000 people on this particular webinar. Gaby, can I hand over to you for a few minutes?
Sure, thank you, Ashraf. I think there were quite a few questions that were more on the medical side. So perhaps Mpumi can also comment because she answered most of those questions. There were a couple of questions about screening of workers and what is legally required. I've just answered one of the questions. So screening of workers is a legal requirement for COVID-19. You have to do screening. There is no question about it. How exactly you do that screening? That's more up to you. You know, and also I need to emphasize that passing the screen and not having symptoms, like we've said a few times during our presentation, does not mean that you don't have contracted, that you don't have the virus, that you haven't been exposed. It just means that you don't have any symptoms. So all the measures needs to be in place, even if the screening is showing that your temperature is fine and you don't have any of the other symptoms like coughing and so on. You still have to follow all the guidelines regarding protecting your safety and the safety of the co-workers in the work environment. So I think that's more what I want to say.
Thank you for that. Dikeledi, before I go to you, I just want to ask Dr. Ndaba if she wants to maybe briefly share some of her impressions on the questions that have been covered by her and the team of panelists from the occupational medicine section. Ume, are you in a position to do so?
Yes, Ashraf, thank you. Greetings to everyone. Some of the questions that have been shared are around, I think, some of the controls or some of the practices in workplaces. I'll pick up on a few. The issue of symptom screening versus temperature screening is very crucial. When we talk about screening, we normally are talking about symptom screening, but temperature screening was part of that screening. But currently it's no longer a requirement because the symptoms that we are asking, it's more of subjective. Do you have fever or not? However, workplaces, we're assisting with temperature screening to help people to be aware whether they've got any temperature or not. But currently, symptom screening is still, yes, a legal requirement. And the other part is that you might screen people at entry or maybe at the beginning of the shift, but it's important that you also empower people that should they have any symptoms that might emerge during the day, they should be free to report such and be able to consult for such. Another question was on specific issues like the breathalyzer use, like spirometry and so forth. There are, some of the questions as well are about specific practices in specific workplaces. I've advised people that for those specific practices, it's difficult to give a blanket answer for them. For the spirometry questions, I have asked people that they should look at the South African Thoracic Society. That talks about there's a latest spirometry guideline that is very detailed, even in terms of infection prevention and control, and what should be taken into consideration before you resume spirometry in your workplace. And the other ones in terms of, I think it was the breathalyzer. And I said, it's difficult to have a blanket answer to all breathalyzers, but you look at your specific one. And as part of a risk assessment, look at how it's used. Is there potential or is there likelihood that there could be exposure? And then also work with the manufacturer or whoever provided it to say, how do you ensure that you continue to have the same outcome, but making sure that you protect people? A lot of breathalyzer manufacturers have actually put some things in place to ensure that there's minimizing infection or cross-contamination. I think that is all from my side, but if there's anything that I've missed, please, people should feel free to email us info@nih.ac.za. Thank you.
Thank you very much for that, Dr. Ndaba, who's taking care of our occupational medicine section, as well as organized the team of occupational medical specialists for the purpose of the answering the Q&A questions. And for the last minute or two, Dikeledi, any final comments from you, having perhaps had a chance to look through some of the questions that have been answered already? Dikeledi?
Thanks, Ashraf. You know, I joined the session late, as I've reported, but I think Gabby and Dr. Ndaba has covered most of the things, but I've identified one question now of someone asking if we are able to assist them in assessing their risk assessment in order to see if they've adequately addressed the risk assessment. So I would say to the person, it's okay. We do get some queries of people seeking our advice. If I've said that in the presentation, you may need external expertise where necessary. So they can email any one of us, or they can email me the report, then I can look at the report and then we can advise where necessary. And overall, I don't have much to say, but I would like to just emphasize that risk assessment is important, because without risk assessment, you won't be able to see where you're missing things in your workplace. And then it must be communicated effectively with everyone in the workplace, and then staff or employees are encouraged to comply. So there must be communication between employer and employees so that they can work together in order to achieve whatever needs to be achieved in the company. Thanks.
Thank you very much for that. That is Dikeledi Matuka, one of our leading colleagues in the immunology and microbiology section of the NIH. And at this point in time, I have the pleasure just of thanking all of you for having made the time to attend this webinar today. Again, oversubscribed. We had over 2,000 people registering, and we have a capacity of 1,000 logins, and therefore we streamed the particular webinar live on our YouTube channel. And just to remind you that the YouTube channel would have the recording of the full webinar, and this will be uploaded to the YouTube channel after this webinar. And as indicated, your general certificates of attendance will be also made available. But for the CPD certificate of attendance, you would have to do the online test. The presentations and the links thereto will be placed, the presentations will be placed on our website, www.nih.ac.za, www.nioh.ac.za, and the links will be emailed to all of those who had attended. So at this point, I need to say thank you very much to Dr. Graham Chin, occupational medicine practitioner in the NIH's National SHE Department, Gabriel Izan from our occupational hygiene section, Dikeledi Matuka from our immunology and microbiology section, Dr. Nompumelelo Ndaba from our occupational medicine section, the occupational medicine section at the NIH, and her colleagues. And some of those colleagues I just want to say thanks to, the list dropped down. It was Dr. Mazvita Mberi, Edward Sipirwa, as well as Dr. Shlonipile Maso, and again, as I said, Dr. Nopumele Ndaba. Thank you very much for all of your contributions to answering. I think it was almost close to 100 questions on the Q&A box. And that's where we conclude this particular webinar. I'm going to quickly play that post-webinar video for some of the key links and some of the key places you need to go to secure your post-webinar presentations. For those who are still around, quickly have a look at the slides there. Make sure you take screenshots of what's in those slides, and there you'll be able to get the links to our website, our Twitter handle, our YouTube channel, our hotline, which you can call for medical specific questions that you might have, and our general NIH email address, that is info@nih.ac.za. Thank you very much. We'll see you on the next webinar, and we've got 2 webinars scheduled for next week. The invites for those will be circulated to all of you. And thanks again to our presenters and panelists. Goodbye. See you on our next webinar.